Contracting COVID could cost you. A lot depends on whether you're insured or if you're hospitalized.
Your final bill could be similar to a new smartphone, a new car, or even a new house. News specialist Lad Egan is live with more. Lad?
Yeah, there is sticker shock when it comes to the hospital bill for COVID-19. That new study shows that the final bill can vary drastically, and that's exactly what Utah families are discovering.
This is just for the month of July.
It took Mindy Green 4 hours to open all the bills after her husband Russell spent 94 days in the hospital battling COVID. She says it was overwhelming when the bills first came in.
They were billing me like $400,000. And I was just like, oh my gosh, I don't even know where to start with this.
Russell is home now recovering and making good progress, but even months later, she's still adding up the final cost.
I would say if I were to sit down with a calculator right now, I'm easily over $1 million at this point.
She thinks her family's portion will be around $50,000. A new analysis by Fair Health looks at billions of private claim records, finding nationwide a complex hospitalization totals nearly $318,000 out of network or over $98,000 with insurance. Utah comes in below those national totals with an average out-of-network bill of more than $261,000 for a complex case or $92,000 with insurance.
Just on copays, probably close to $5,000. I went to the ER 8 times.
The founder of the Utah COVID-19 long haulers said some are seeing much higher bills, like a member of their group who was hospitalized for a month.
He received a bill in the mail that was in excess of $1 million. So imagine getting a bill like that.
It's a ton of work.
Green says they aren't focusing on the bills, but the blessings they've received.
I mean, we'll recover financially and we'll end up being okay because my husband was able to come home because of the prayers and the service that so many people offered.
Glad he is home and recovering well. This study also looked at COVID-19 cases that required treatment but did not require hospitalization. And it found that Utah was among the lowest for that price point, saying our state averaged $732 to treat COVID cases outside of the hospital. And Ashley, one piece of advice from the Green family, they say to wait and deal with those hospital bills once your loved one is out of the hospital.
Yeah, I mean, you can't imagine what these families are going through in the hospital and then getting a bill like this. Lad, thank you.